What are the situations in which phase 4 of Korotkoff sounds are used to measure the diastolic blood pressure? Phase 4 diastolic pressure is measured in all hyperdynamic circulatory states, which include pregnancy, children, aortic regurgitation, thyrotoxicosis, anemia, and beriberi. Korotkoff sounds are divided into 5 phases, 1 to 5. Usually, phase 5 is taken for measurement of the diastolic pressure. These sounds were named after Nikolai Korotkoff. They were discovered in 1905 while he was working at Imperial Medical Academy in St. Petersburg. Phase 4 is muffling of the Korotkoff sounds and phase 5 is disappearance. Systolic blood pressure is taken at phase 1. In some cases of severe aortic regurgitation, if you go for phase 5 diastolic blood pressure, we may get it as 0. There is also a method of recording diastolic pressures at both phase 4 and phase 5. A study evaluated the inter-observer variability of blood pressure measurements in pregnancy. They found that variability was more when calculating the phase 4 diastolic pressure, which it was not so with phase 5 diastolic pressure. Hence, the authors of that study recommended using phase 5 for better accuracy and reliability.